Gastrointestinal, a review of GI assessment, nutritional deficiencies, and bariatric review. It's important to be able to identify the organs located in the abdominal area. When you're assessing the abdomen, you start with inspection, auscultation, percussion, palpation. The reason why palpation is last is that the pressure on the abdominal wall and contents could interfere with bowel sounds and cause pain. A painful area on the abdomen should be assessed last. So think about the major organ in the right upper quadrant, the liver. What about the right lower quadrant? Think the appendix. The major organ felt at the costovertebral angle, the kidney. And the organ felt in the left upper quadrant, the spleen. So consider when absent bowel sounds are normal and when they're abnormal. After abdominal surgery, could be an expectation. Otherwise, it would be considered a complication. How often do you hear normal bowel sounds? About every 5 to 15 seconds. Hyperactive, high tinkling, growling bowel sounds are known as boborgamous. Hunger pain is one of them. For a Rob scene, this happens when there is palpation of the left lower quadrant, then causes pain in the right lower quadrant. The Kerr's sign. This is acute pain in the shoulder due to blood in the peritoneal cavity when a person is lying down and the legs are elevated. It is referred pain to the right, and it could be due to irritation of the diaphragm. A classic sign would be a ruptured spleen, liver trauma, free air, or intra-abdominal bleeding. The best way to remember is to think of a parrot on a pirate's shoulder for the Kerr's sign. Trendelenburg position is used for pelvic surgery and to treat shock, in which a patient lies face upward on a tilted table or bed with the pelvis higher than the head. Supine is a position of the body, lying with the face up. Prone position is face down, and that can be used to increase pulmonary function. A right side lying position would promote stomach emptying. A left side lying position would retain the contents. Fowler's position is a standard position. It's an intervention used to promote oxygenation by way of chest expansion and implemented during episodes of respiratory distress. The Fowler position facilitates the relaxing of tension of the abdominal muscles, allowed for improving breathing. Lithotomy position is a supine position of the body with the legs separated, flexed, and supported in raised stirrup, originally used for childbirth. A Sims position is the left side lying position with the right knee flexed and is used to give an enema. Now remember, allow the enema solution to flow downward by gravity along the natural curve of the sigmoid colon and rectum, and that would improve retention of the solution. Bowel movements. When's the best time to have a bowel movement? Whenever the patient says they have to go, or after a meal, or coffee. What happens if they have severe bouts of constipation? Well, think of external hemorrhoids. You may also hear them called prolapsed hemorrhoids because they're visible from the rectum and anal area. Internal hemorrhoids are less likely with constipation, so it would be important to assess why a patient is developing hemorrhoids. A medication for chronic constipation, think something like Metamucil, but they would need to increase their fluid intake when taking bulk-forming laxatives to avoid worsening the constipation. Many times, increased gas is likely to occur with increased dietary fiber. You would need to be careful of digitally removing feces from a heart patient. Because of the potential to stimulate the sacral branch of the vagus nerve, patients with a history of dysrhythmia or heart disease have a greater risk for changes in a heart rhythm. Be sure to monitor the pulse before and during the procedure. It may be contraindicated, though, in some cardiac patients, so if in doubt, verify with the physician. The best indicator for acute nutritional changes? Well, serum proteins give accurate nutritional information and include albumin, serum albumin, retinol binding protein, and transferrin. Serum proteins with long half-lives, like albumin, tend to be global indicators of nutritional status, and proteins with shorter half-lives, like prealbumin and transferrin, provide information on acute nutritional status change. The signs of nutrient deficiencies, reviewing this screen, the hands, the gums, eyes, mouth, skin, nails, and throat. And each of these would be able to give you an idea of the vitamin deficiency. Vitamins A and E are fat-soluble vitamins and stored in the fat cells of the body, so excessive amounts of the fat-soluble vitamins would lead to toxicity. Fat-soluble vitamin absorption is blocked by stool softeners and lubricants, but not by bulk-forming laxative. Physical assessment is information in order to determine whether or not someone might have a vitamin C deficiency. Vitamin C deficiency includes swollen bleeding gums, delayed wound healing, weakness, depression, and easy bruising. A thiamine deficiency includes presence of muscle cramps and ataxia. Clinical effects of malnutrition. Think about who is at risk. Those are economically disadvantaged, poverty, drug and alcohol abusers, those who have chronic nausea, vomiting, diarrhea. So it's important to check the lab values and then look for complications like poor wound healing, increased risk of infection, and lethargy leading to activity intolerance. Ventilation would be loss of muscle and hypoxic response and decreased cardiac output. Looking at tube feeding for a patient. If they had loose stools after receiving full-strength tube feedings, then it could mean poor absorption of the nutrients, and the tube feeding would need to be slowed down. The tubing and the formula are changed every 24 hours. The patient would need to start with clear liquid diets in small amounts first, and then limit food intake and slowly increase to solid foods. They may also need to take antidiarrheal medications. Total parenteral nutrition is central venous access, if they have lipids or protein dextrose vitamins. Nursing consideration is to monitor daily weights and eyes and nose, and carefully check the contents. Make sure that there is no leakage or it's cloudy. Complications could be fluid imbalances, electrolyte imbalance, so check the labs and liver functions. Partial parenteral nutrition can be given through an IV line as the solution is not as dense. Total parenteral nutrition must be given through that central line. This is because the parenteral nutrition has more than 10% dextrose, which is a hypertonic solution. TPN should never be interrupted. The infusion must be continuous to prevent hypoglycemic reactions. The lab test to check before lipid therapy and TPN, triglycerides, would need to be done at the initiation of fat therapy for a baseline and 6 hours after the fat has infused. This is drawn to determine a patient's ability to metabolize lipids. Lipids are also known as fat emulsions and should hang no longer than 12 hours and should not be given too rapidly. Bariatric patients may be difficult to care for due to their size, as well as comorbid conditions associated with obesity, including hypertension, diabetes, high cholesterol, obstructive sleep apnea, depression, anxiety, joint pain, and limited mobility, all which increase the risk of complications and a longer hospital stay. Non-surgical management of obesity is fasting. There are the novelty diets like Atkins or South Beach, diet therapy from Weight Watchers, but the best is exercise program, behavior modification by keeping a food diary, and notice if there is emotional and situational influences to eating, and looking at drug therapy, Xenocol, which inhibits lipase as the fats are partially digested. The Roux-en-Y procedure reduces the stomach to the size of a small egg by cutting and stapling to create a pouch. The gastric band is an adjustable device placed around the top portion of the stomach to create a small pouch. Sleeve gastrectomy is a procedure that removes approximately 2/3 of the stomach, leaving the remaining portion of the stomach long and slender in the shape of a garden hose. The immediate post-op care for patients undergoing these surgeries is similar in the fact that they all must decrease food portions. Complications include leaks, bleeding, obstructions, and a slip band. It's important to notify the physician of persistent tachycardia, sudden onset of left shoulder pain, fever, and decreased urine output, because these are symptoms of a leak. Severe abdominal pain and nausea with emesis of bile could be symptoms of a bowel obstruction. Complication, they're at risk for a DVT, so early mobility is needed. Complication could be narrowing of the opening between the stomach and the small intestine where strictures can form. Gallstones and bleeding ulcers are about 1 in 100 may develop. Altered digestion, long-term nutritional deficiencies may happen. Dumping syndrome can occur. Symptoms are tachycardia, nausea, diarrhea, abdominal cramping, and the patient is also at risk for infections. Skin care is important because they are high risk for breakdown and delayed wound healing. The folds become moist and harbor yeast and bacteria. Uses of powder is discouraged. So daily inspection, frequent turning, and watch for shearing is needed for good skin care. Weight loss strategies. To reduce body weight by 10% of baseline within 6 months would need to decrease a caloric intake from 300 to 500 calories a day. This could result in a loss of 1 to 2 pounds a week. Eat slowly so that the brain gets the message that the stomach is full. Take seconds of vegetables and salads instead of high-calorie foods. Try to eat 3 balanced meals at regular times and record all food that is eaten. Dietary concerns after surgery: iron deficiency, B12 deficiency, where they may need B12 injections. And dietary modifications would be avoid foods high in sugar, avoid alcoholic beverages, and avoid high protein foods.